All right. Guess we should wait for people to filter in.
Okay.
It's supposed to say like when people start coming in.
Sounds good. You should look happy.
Okay, we've got people watching now.
Yeah, 10 people.
Right. Well, hello, everybody. We're going to give it just a minute to see if more people want to hop on before we get started talking about coronavirus. So is this your first Facebook Live?
Here, yeah, I think.
Okay.
Yeah, I would say it's a relatively short list of Facebook Lives, but it's great to be here.
Yeah, I think this is my first one, too. Especially me putting it up on my phone here.
Excellent. So far, so good. Looks good from our angle here.
Right. People are still hopping on here.
That's good.
Thank you, everybody, for hopping on here. In a minute, we'll start talking about coronavirus. We have some decided questions that we're going to ask each other. We have Jim Abbott here. He's our business and tourism reporter, so he's going to talk a little bit about how it's impacting hotel sales and Bike Week, which is coming up pretty soon. And then I'm the health reporter, and I'll be talking about kind of the more general things about coronavirus and what we should be watching out for and doing here in Volusia and Flagler counties.
Very good.
Right.
We ready to get rolling?
Yeah, I think we should start to get rolling. People hop on in.
Good. Well, we'll get some of the basics from Nikki here to begin with. She's got a very informative Q&A that you can find on our website right now. And so tell us just in a general sense what coronavirus is and what the symptoms are.
All right. So coronavirus, the strain going around now is one that has not been detected in humans before. That's why it's called novel coronavirus. There are other strains of coronavirus that transmit between animals and humans that kind of go around like the common cold. But this is a new one that's a lot stronger than others that have been out there. So the main symptoms of this coronavirus is a fever, coughing, and shortness of breath. So if you're having difficulty breathing and stuff like that, and you've traveled to one of the areas across the country that have outbreaks of coronavirus, like China or South Korea, even Italy now, then you should probably get checked out by a healthcare provider.
And the symptoms are somewhat like the flu, basically, or I mean, how sick do people get from this, or generally so far?
So it can be anywhere from an extreme illness to something like the common cold. It just really depends on how your immune system reacts to it, much like the flu. The severity depends by person to person. For the generally healthy person, it can present like a really bad flu or upper or lower respiratory infection. So if any of you have ever experienced bronchitis, you might feel kind of like you have that. And then for others, it can be really deadly, especially for the elderly and people with compromised immune systems. Those are who it seems to be affecting the worst. But otherwise, it does seem to be acting much like the flu or a cold.
And there are 2 potential cases now in Florida, right? Tell us what we know at this point about that.
Mm-hmm. So the 2 potential cases are in Hillsborough County and Manatee County, which are in the Tampa Bay area. The one person is quarantined at home. It was a self-quarantine, and then another is being treated at a local hospital. Not much more information has been given out about it. One of those people have traveled to one of the countries that have outbreaks, and the other one, they think, got it from it passing somehow through here because they haven't been traveling outside of the county, so we're not quite sure where the other one originated.
And what do people what are some of the guidelines for people to do to try to avoid getting this? There are things, I know washing your hands is one of them, but what are some of the things that people should be alert to do, just to be in an abundance of caution?
Yeah, so washing your hands is a big thing. Also, like if you're coughing or sneezing, doing it in your arm instead of on your hands. So what they've noticed is it transfers a lot like any other flu or virus. So cleaning things, disinfecting things. The recommendations is using bleach or alcohol or ammonia-based cleaning products to clean everything, and washing your hands. They say hand sanitizer is okay, but it's not going to do the best job. You should really be washing your hands quite frequently. Also, like normal, just avoid people who are sick. Make sure that if you're sick, you stay home and you don't go to work or go out in public, just to minimize any spread if you do happen to catch it.
Very good. And what's going on in Volusia County? I mean, what are some of the agencies doing? I guess the county health department, have they issued any kind of advisories or anything yet, or are they still determining what's going on? What's happening here locally?
So it kind of seems like they're still in a waiting and holding pattern here. They're kind of waiting to take direction from the State Department of Health locally for local health departments. Schools are also waiting for the health department. Hospitals are waiting on the health department and the CDC. So it's going to trickle down from the statewide level to the local level. So we've heard from colleges, school districts, hospitals, nursing homes, and a wide variety of other organizations like local shelters is that they're waiting for cues from these health departments, and they are also taking precautions like making sure they wash their hands, and they all say they have a pandemic protocol in place. So if it does start to spread here, they will take care of what they need to take care of, but they're not being too specific about what these things are.
Okay, very good. Well, I know that the folks that are organizing Bike Week are waiting, are say that they will follow any advisories they get from the county health department. But so far, Bike Week, as we understand from the organizers, is still underway. It's business as usual so far in terms of that event going on. It's an event where a lot of people are going to be gathering, but the organizers with the Daytona Regional Chamber of Commerce are advising folks to follow these same precautions that you mentioned, washing your hands frequently, and trying to not to go out if you're feeling sick. And some of those basic precautions are basically the only advice they have for people that might be thinking about coming out to Main Street or one of the areas for Bike Week.
And so does it seem like people are being deterred, like our hotel bookings down, or how's that going?
Well, I talked with some of the hoteliers today and some of the tourism folks, and at least to this point, the hotels have had virtually no impact from this. I mean, there's been a few cancellations, but they're basically saying that so far, it's been a non-issue, and their bookings actually are running really well. They're doing really well compared to last year, where there seemed to be a little bit of a slow run up to Bike Week last year, but this year, a couple of the hoteliers I talked to, they're anticipating being sold out for both the weekends. It gets a little slower during the week, but one of the hoteliers that I talked to said that Daytona, the event sort of might be benefiting from the fact that Daytona, unlike obviously New York or San Francisco or even Orlando, is not really a hub for international travel. So, and a lot of the folks that come to Bike Week, it's a drive destination, and so that makes it sort of not doesn't have that laser focus on it being an area where you're maybe going to run into people that are going to be infected with this. So in this case, the fact that it's kind of a drive market seems to be working in the favor of the hoteliers. People don't seem to be too nervous about it right now.
Okay, and so I'm assuming kind of the same view as from Bike Week is the same as for spring break?
Yeah, spring breakers. I've talked to Scott Edwards over at the Welcome Center that has worked with spring breakers for decades, booking hotel rooms. He says there's virtually no concern among the college crowd about coronavirus. His remark to me was that they're more concerned that they don't run out of Corona beer than dealing with the coronavirus. But it is not, at least so far, and he seemed optimistic that at least through March, when the bulk of the spring breakers are coming in here, he doesn't anticipate that there's going to be any concern, at least at this point. But obviously things are fluid, and they, things can change. So people should stay alert, and I think, and that's the thing that one of the hoteliers also was telling me, that they're basically trying to instill in their staff the same things we've been talking about, washing their hands and being just common sense things. And he says as the guests start to arrive, they're going to try to, with confidence and politely try to reinforce that message with their guests too.
Okay. And then, so I know that throughout Facebook, there have been a lot of questions about wearing masks and if that's the way to go. The CDC does not recommend that healthy, non-sick people wear masks. They should be saved for those who are infected with coronavirus so that they don't spread it by breathing or like accidentally spitting on somebody. And it should also be saved for the healthcare workers who are dealing with these patients that have coronavirus, because I know that locally here, there's kind of a shortage of surgical masks. I know that some healthcare entities have been ordering extra to make sure that they have some because they are worried about there not being enough supply because people are buying them up. So to answer all of you who want to know if you should wear a face mask, no, you probably should not unless you are sick with coronavirus. That's
the point, is to really just, unless you're around them, serving them or treating them, or that you have it, it's not really helping you.
Yeah.
And somebody else might actually need it.
Yes. So just keep that in mind. And then another thing that health organizations have been recommending is that if a loved one or somebody that you live with is sick with coronavirus or has symptoms that could potentially be coronavirus, that you should also stay home so that you don't spread it to others if you've caught it already.
Oh, okay. That's a good point.
Yeah. So it's a little bit different from the flu. Usually, like if you catch the flu and like your significant other doesn't have it, they'll go to work. But in this case, you should probably stay home.
Wow. Okay. Good to know.
Yeah.
Cool.
All right. Is there anything else?
Anything else? I don't know. I think we might have hit some things. I don't know if we have any questions. I don't know where the Surgeon General was during all of this.
Yes,
but,
I'm clear.
So I can confidently say I don't know how to answer
I'm not
that.
sure either, Randy. Let's see. Does anybody else have any questions before we hop off here?
Make sure to check out Nikki's story, and
Yes.
I have a story up about the impact on tourism and on the News Journal website.
Yeah, and we'll be keeping up. We'll be posting state news, national news about coronavirus. Even if I'm not the one to write it, we'll still post stuff around the state. So we'll keep you up to date on that. And then we'll also be checking on things locally as coronavirus progresses. So
Great.
Make sure to tune in to newsjournal.com.
Okay.
All right.
Thank you, guys.
Thanks, guys.